Okay, so for my research this week, I had the frequency and duration for OT sessions in a hospital for a patient who has a spinal cord injury, home evaluations, if they should be done or not should be done, and then I'm going to role play kind of how to explain the prognosis to a patient who just experienced a spinal cord injury. So I can't record on Zoom because my computer is not working, but I'm going to share the link with my PowerPoint slides along with this video since I can't share my screen. But if I'm looking at this way, it's because I'm looking at my slides. Okay, so for the frequency and duration at Gaylord Hospital, where Hasid is in right now, it didn't give an exact amount of days and hours that patients with a spinal cord injury would go to OT sessions, but it did say that therapy is provided Monday through Saturday, so 6 days a week, and involves physical therapy, occupational therapy, speech, and respiratory therapy. And then the amount of therapy each patient is prescribed is based upon their clinical eval before admission. And then again, what is done in those therapy sessions kind of depends on the severity of the case and what spinal cord injury that patient experienced. And then I looked at, because I wanted more of a specific amount of hours and days. So then I was looking up other hospitals, and then the Mount Sinai Spinal Cord Rehab Center said to maximize functional recovery, each patient receives a minimum of 3 hours of therapy 5 days a week. So again, every day for 3 hours, 5 days a week. And then I was kind of looking at other hospitals and kind of seeing their average. And then I found a really good study that was done that involved 600 patients with traumatic spinal cord injuries. And they were admitted to 6 different rehab centers. And then the average duration and frequency of OT sessions for that particular study was they were in there for 55 days, during which 180 hours of treatment were received, or 24 hours per week. And then, again, each treatment plan was different for each patient, obviously, depending on their case. And then the variation in minutes per week of treatment delivered by individual was predicted poorly by the patient and the injury characteristics. So again, what that patient was experiencing kind of dependent on what that patient was experiencing affected the frequency and duration. That's what I'm trying to say, of the OT sessions. But with those 3 different articles that I found and the 2 different hospitals, the kind of average that I was seeing was about 3 hours to 3.5 hours every single day of therapy. And I also found it interesting that with spinal cord injury hospitals, there is group therapies besides individual therapy as well, which I found really interesting. And then for home evaluations, should they be done, should they not be done? In the textbook, it said that it should be done, home evaluations, before discharge. You just want to make sure that when you're doing the home eval, you give the family members or caregiver enough time to make those home modifications before the patient goes home. But you also might want to do 2 home evals, one in the beginning and then one at the end, because one right before they go home, so they can practice the equipment they learned in their home setting, and then you can kind of make more modifications if you have to with the new skills they learned and new equipment. So yes, home evals are totally recommended, and it said in the textbook that maybe 2 of them would be good for a patient with a spinal cord injury. Also, they said for the home evals that it's a great opportunity for the caregivers and family members, because you're educating them on more of spinal cord injuries and kind of what needs to be done. So it's a great way for them to get involved as well. So you want to make sure that when you're doing that home eval, the caregiver or family member or whoever is in the process as well. And then for my last part of my research, I'm just going to do a role play with my sister on kind of how to explain to a patient like Hasid or Hassad. I don't know how to pronounce his name, but kind of how do you explain that prognosis to a patient who just experienced something really traumatic. And I think with a spinal cord injury, you really want to be empathetic with them, but you also want to kind of instruct them and educate them on what their life is now going to look like. Obviously it's changed. So you kind of want to just like go over how it changed and how it's gonna what adaptations you're gonna have to do and what your role is with that patient. And you also want to find out the best type of way they like to learn it. If they don't like to read a bunch of information, then maybe find videos for them or pictures, stuff like that. So yeah, I'm gonna kind of show that in our role play right now. And you also want to make sure you build rapport and trust, obviously, so that patient trusts you and wants to come back to your therapy sessions. Okay, so you can come in now. So again, I have, before I start, I have a diagram pulled up that I can't show you, but I'm gonna post it with this video. Okay. And scene. Okay. Hi, Assad. How are you feeling today?
Not so good.
Yeah, so I know last week we only really met once before. So you kind of probably are still new to what happened to you and what this kind of all means. Mm-hmm. Okay, so I know you've had a C6 spinal cord injury incomplete. So there's an incomplete spinal cord injury and then there's a complete spinal cord injury. And with a complete spinal cord injury, that's when there's no motor or sensory, so you can't really feel certain things like heat or pressure. And then motor skills are also impaired too with a complete spinal cord injury, but you have incomplete. So what that means is there is some sensory function still preserved with you, which is a good thing. So with a C6, that's higher up, so that's going to be your neck. That's going to be your neck, diaphragm, and arm muscles. So I have a diagram pulled up, because I know last week I kind of asked you what type of learning you like. You don't like to read like a bunch of information, you rather like look at pictures, right? Mm-hmm. Okay. So again, this is a great diagram, I think, if you want to look at it. You see all the functional activities up there, like eating, dressing, bathing, grooming, toileting, and walking. And with those functional activities, there's different symbols. And what those symbols mean are at the bottom of the page. But for example, if you see a star next to eating, that means that you're just going to need assistance or equipment to help you doing that eating or feeding. You did have a C6, so when it comes to walking, there are different wonderful wheelchairs out there that have made different designs and different, techniques, and it's really so much advancement that can help you so much. So that is going to look a little bit different, but again, there's so much equipment out there that can really help. So I kind of want just you to look at this diagram for a little and look at all the different functional activities and the symbols. And do you have any questions so far?
No.
So I also want to talk about different resources I have with me, because I know we talked about driving during our initial meeting, and you said that's something are you ever going to be able to do again, or you want to do. So there are actually so many good resources and centers out there that have different adaptive equipment for driving that you can use. So I have also all that information here with me too that you can take the time and look over. So again, your life is going to look different, but again, with the right assistance and equipment, a lot of these things you'll be able to do with that equipment and assistance.
That's great to hear.
So I'll give you time to look at that. So while you're reading that over, I'll get all the other resources I have for you. And do you have any other questions?
Not that I can think of, no.
Okay. So during that role play, again, you kind of want to just educate the patient on the prognosis, and also, be there for them and say that, you're here to help, But also, again, their life is going to be a lot different now with a spinal cord injury. So you do want to, make them aware of what is going to look different. So that's why this picture and diagram was great that I pulled up that I'm going to share share a link with the diagram. So yeah, that's all.